Hi, I'm Dr. Kimberly Matthews, and this is Ruth. She's my nurse, and we know that a lot of times when you get prepared for your yearly exam, you maybe have some questions. Some of them you may be embarrassed to ask, and so we just put together a list today of some questions that we commonly get from our patients, and hopefully some of the questions, maybe ones you have, and they may be helpful to you to hear the answers.
And a lot of times we get asked, why do we even need a PAP or a yearly exam, and how often do we need them, and those kinds of questions. So
what do we tell our patients?
Yeah.
Well, the reason we get a pap smear in particular is because that is a screening exam to look for any evidence of cervical dysplasia or cervical cancer. We also, at the yearly exam, though, we do a breast exam. We find out how things are going in general, how your periods are, and we basically do a full exam. So we really need to have a yearly exam every year. Now, whether we need a pap smear every year or not is dependent on our age, our history of abnormal pap smears, and so that's something that you'll want to discuss with your provider. But every year we should have you come in, find out how you're doing, and do a full exam at least.
A lot of patients come in and they ask, how can I prepare for this exam, and I might smell down there and things like that. So
they do.
What do you tell them?
I know. It does make you, even we know as
nervous.
Women, we get a little bit self-conscious about that,
Sure.
don't we? But I mean, I would say in general, it's very rare to have a patient that has an odor down there. I know we all worry about that, and so we bathe in the morning and we, feel like, should I do those things? Please don't do that. We really don't want you to douche. It's very rare, like I said, to have an odor, and occasionally if we do have an odor, it may be the sign of something, like an infection, something that we need to treat. So it's better that we know about those things. So please don't feel self-conscious, even though I know it's common to feel that way.
And sometimes people say, that they hurt, and there's different ways that we can help them get through the procedure without.
That is true. Yeah, especially sometimes for the first exam,
Exactly.
Women are worried about that. And so, if it's your first exam, we really try to go through the exam with you in detail. Usually it's just myself and the patient in the exam room. However, occasionally we do bring Ruth in, and she's held several women's hands.
Get them through the procedure.
To get them through the procedure, especially for sometimes the first time you'll come in.
And most of them say, it wasn't as bad as I thought it was going to be.
Exactly. That's usually the answer. We all work ourselves up to the
Yeah.
exam. But one thing, the most important thing that you can do is really try to relax through the exam. The vagina is a muscle, and so if you're tense, that kind of makes the exam more difficult, because you do tense up that muscle. So if you can really relax, and there are ways that I usually try to help you relax through the exam, help you to take deep breaths and relax.
Talk you through it.
And talk you through it, exactly.
Yeah.
But that's the most important thing. And then we also have different size speculums. So for some women, women that are atrophic, postmenopausal, or their first exam, we may, try to use a smaller speculum, and that usually helps as well.
Right. Some people want to know, what do I have to take off? And I say, well, you have to get down to your birthday suit, but you can leave your socks on.
That's right.
Because they think, can I leave my socks on? And I'm going, yeah, that's okay. You can leave your socks on.
Exactly. I would too. It gets
And
colder.
should a patient refrain from sexual intercourse before their exam?
It's probably a good idea to avoid sexual intercourse, especially the night before your exam. There may be... it's just better to refrain from intercourse.
Doesn't it obscure from the test
It may
results
obscure,
sometimes?
from some of the test results, and then if you have problems like discharge, and then we try to take a sample, that may be problematic if you've had intercourse the night before. So if you can avoid it for just one night, that would probably be a good idea. Maybe 2 nights if possible.